South Dakota health insurance. The impact of expiring tax credits. Opinion: South Dakotans brace for impact as Congress contemplates tax credit expiration. In the past few years, a growing number of South Dakotans, including small business owners, entrepreneurs, farmers, and working families, have sought solace in the individual marketplace for their health insurance needs. A crucial component of this health insurance safety net is the bolstered premium tax credits, which have been instrumental in reducing the monthly premium costs for eligible enrollees. However, unless Congress takes swift action, these tax credits are set to expire by the end of the year. Should this come to pass, families in South Dakota and beyond will experience a swift and significant impact. But here's where it gets controversial. Some argue that the expiration of these tax credits could lead to a more competitive and efficient health insurance market, while others maintain that it would only serve to exacerbate the existing affordability crisis. And this is the part most people miss: the potential ripple effect on local economies, as families grapple with the increased financial burden of healthcare costs. Will the GOP save Obamacare subsidies? 2026 midterms impact. Could the GOP reverse course on Obamacare subsidy cuts to avoid political fallout? By Ed Kilgore, intelligence or political columnist since 2015. Millions of Americans who don't qualify for Medicaid still rely on Obamacare exchanges for their health coverage. Photo Alto/Getty Images. With Donald Trump's One Big Beautiful Bill now law, you might think both parties would shift to spinning its impacts ahead of the 2026 midterms. And to some degree, that's true. But Congress isn't done legislating this year, and there's one potential move that could soften the blow of the bill's severe healthcare cuts. It relates to the enhanced premium tax credits for insurance plans bought on Affordable Care Act exchanges, as explained by KFF. These boosted credits, first established in the 2021 American Rescue Plan and extended through 2025 via the Inflation Reduction Act, helped more than double exchange enrollment to around 24.3 million people. That's slightly more than those benefiting from Medicaid expansion. The legislation made the expanded credits available to low-income earners making between $15,060 and $60,240 annually, as well as, for the first time, to middle-income earners above that range who previously didn't qualify. Unless Congress acts, the enhanced credits will expire this year. While this expiration wouldn't directly eliminate anyone's coverage, it would significantly raise premiums for Obamacare exchange plans. Over 19 million Americans qualify for these credits, which save the average recipient about $700 per year. One credible estimate found letting them lapse would result in an average increase of over 75% in net premium payments. The CBO project's 3.8 million would drop their insurance entirely. Because this expiration hasn't gotten nearly as much attention as the bill's Medicaid cuts, the steep premium hikes likely to be announced this fall will blindside many affected Americans, including Trump voters. The enhanced credits have been crucial in expanding coverage in red states like Florida and Texas that rejected Obamacare's Medicaid expansion. So it's not surprising that some are urging Republicans to work with Democrats to extend the credits through regular tax legislation, outside the budget reconciliation process used for the megabill. In fact, a memo from GOP polling firm Fabrizio Ward suggests extending the enhanced premium tax credits could significantly reduce House Republican losses in 2026 battleground districts by showing compassion for recipients and ensuring the individual market remains a landing spot for working-age adults on Medicaid who lose that coverage. In theory, most Democrats would jump at the chance to fix this issue. But it could get complicated. A bipartisan tax bill could become a magnet for all kinds of amendments. It would also typically require spending offsets, unless the megabill's deceptive treatment of tax cut extensions as deficit neutral continues. And many Republicans will be loath to do anything that props up Obamacare, especially increased subsidies enacted by a Democratic Congress and signed by Joe Biden. They'll only go along if the Trump White House is on board. If the credits aren't extended, Democrats won't have to focus solely on future Medicaid cuts as the megabill's biggest hit to affordable health care. Those soaring premiums will arrive soon, and Republicans who fought so hard to extend tax cuts for the wealthy will have no one to blame but themselves.